This gel is used on the skin to treat acne. It contains a combination of adapalene, a retinoid, and benzoyl peroxide, an antibiotic and skin peeling agent. This product can decrease the number and severity of acne pimples and promote quick healing of pimples that do appear. Adapalene affects the growth of cells and decreases swelling and inflammation, while benzoyl peroxide reduces the amount of acne-causing bacteria and causes the skin to dry and peel off. Use this gel as directed by your doctor. Apply a thin layer to the affected areas once daily in the evening. It is best to apply this medication at the same time each day. Before applying Epiduo gel with pump, make sure to wash your hands. Use a mild or soapless cleanser to gently clean the affected skin and pat it dry. Your doctor will instruct you on how to apply this medication, which is usually once daily. Use your fingertips to apply a small amount of medication, about the size of a pea, to the affected areas of the skin. Only use this medication on the skin and avoid applying it to the inner lip area, inside the nose/mouth, or on mucous membranes. Do not use on cut, scraped, sunburned, or eczema-affected skin. Be careful not to get this medication in your eyes. If it does get into your eyes, flush with large amounts of water and call your doctor if eye irritation develops. After using the medication, wash your hands to prevent accidentally getting it in your eyes. The dosage and treatment plan will be determined by your medical condition and how you respond to treatment. During the first few weeks of using Adapalene, your acne might appear worse because the medication is working on pimples forming inside the skin. Use this medication regularly to get the most benefit from it. Try to use it at the same time each day to help you remember. Do not use a larger amount or use it more often than recommended, as this will not improve your skin any faster and may increase the risk of developing redness, peeling, and pain. If your condition does not improve or worsens, make sure to tell your doctor. Due to the risk of harm to an unborn baby, women who are pregnant or may become pregnant should not handle this medication. If you are using Epiduo gel with pump, you may experience skin redness, dryness, peeling, mild burning, swelling, or a worsening of acne during the first 4 weeks of use. These effects typically decrease with continued use, but if they persist or worsen, it's important to notify your doctor or pharmacist. Your doctor may recommend using a moisturizer, reducing the frequency of use, or discontinuing use altogether. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug is possible. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Epiduo gel with pump, make sure to tell your doctor or pharmacist if you are allergic to adapalene or benzoyl peroxide, vitamin A-related drugs, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have other skin conditions such as eczema. It's important to note that this medication may bleach hair or colored fabric, so use caution when applying near the hairline and when choosing clothing, bedding, and towels. Additionally, this medication may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to tell your doctor immediately. Also, wait until your skin has completely recovered from a sunburn before using this product, and be mindful of weather extremes such as wind or cold, which may be irritating to the skin. While using this product, it's important to avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas. If you are pregnant or may become pregnant, you should not handle this medication, as it may harm an unborn baby. It's important to talk to your doctor if you are pregnant or plan to become pregnant, and to not become pregnant while using this medication. It is also unknown if this drug passes into breast milk when used on the skin, so be sure to consult your doctor before breastfeeding. It's important to be aware of how Epiduo gel with pump may interact with other medications, as it could affect how they work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's vital to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Epiduo gel with pump include other acne skin treatments such as retinoid and Adapalene. It's also important to avoid using other skin products that are harsh, irritating, or drying on the treated area, such as hair perming solutions, alcohol/lime/menthol containing products, medicated or abrasive soaps, and cosmetics with a strong drying effect. If you have recently used products containing sulfur, resorcinol, or salicylic acid, it's important to use Epiduo gel with pump with caution and wait until the effects of such products on the skin have decreased before using this product. Remember to always follow your doctor's advice and instructions. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the person's safety. It's important not to share your Epiduo gel with pump with others. You can still use cosmetics, but make sure to thoroughly clean your skin before applying the medication. Some cosmetics and soaps might make your acne worse, but moisturizers should be safe to use. When buying cosmetics, moisturizers, or other skin care products, look for labels that say non-comedogenic or non-acnogenic. These products are unlikely to make your acne worse. If you're not sure which products are safe to use, ask your doctor or pharmacist for advice. It's important to remember that acne is not caused by dirt, so cleaning your skin too often or too vigorously can actually make your acne worse. If you forget to use Epiduo gel with pump at your regular time, apply it as soon as you remember. If it's close to the time for your next dose, then just wait and use it then. Don't use extra to make up for the missed dose. Make sure to store Epiduo gel with pump at room temperature and avoid freezing it. Keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless you're told to do so. When you no longer need it or it's expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.